is your station?
I am ready.
Yes, just 1 second left. Right. So if you've read and understood, considering it history taking station, please begin.
Hello, I am Dr. Ahmed Awad. I am one of the surgical doctors. Can I check your arm bracelet, please? Okay, Miss Victoria, you are here for evaluation regarding your surgery, and I will ask you some questions to assess your fitness for surgery. Okay? Anybody hear me?
I can
Hello?
hear you.
Yeah. Hello, I am Dr. Ahmed. I am one of the surgical doctor. Let me check your breast, please. Okay,
Yes, you can.
okay. Miss Victoria, you are here to evaluate you for your surgery. You have a schedule for left hip replacement. Am I right?
Yes, doctor. I had joint pain since long, and I postponed this surgery because of my father's condition, but now I want to go for it.
Okay. How the pain affecting your life?
Very bad. I can't walk, can't stand from my sitting position, and if I take few steps, it's very painful, and I can't go upstairs.
Oh, I am sorry to hear that. Okay. Do you take any medication for your pain, for this
Yes,
hip pain?
yes. I do take NSAIDs and over-the-counter pain medication.
Okay. How you take? How you give the pain score? If I said to you 0, there is no pain. 10 is very severe pain. How
Uh,
you
I,
give the?
w- I would give it up to 10.
Oh, I'm sorry for that. It's frustrating pain for you. Okay. Can I ask you some question about your? Do you have any heart problem?
Yes, doctor. I sometimes have chest pain and I use medication for it. And I'm
Okay.
on pro-
What's the medication you take for this heart problem?
I take aspirin sublingual whenever I have pain.
What else aspirin? Other than aspirin?
I also take anticoagulants, and I once had a nosebleed because of taking them.
Okay. What's the anticoagulant? Can you remember or not?
I think it's uh, clopidogrel or something.
What's the dose of this?
It was like 150 mg per day.
Okay. Can you tell me, do you have any hypertension?
Yes, I'm hypertensive as well.
What do you take for this hypertension?
Uh,
You cannot remember? Hello.
drug was propranolol.
Okay. Since when you have the hypertension?
Since 4 years.
Okay. Do you have any chest pain?
Yeah, I on and off have chest pain whenever I go upstairs or do chores.
Since when this chest pain started? Hello. I think there is a connection problem.
Yes.
Right. Okay.
The questions that they have written, they are little different. They have asked that you have to ask the question, how long does the operation will take? Patient will be asking you, and you'll say that you'll tell the operation itself usually takes a couple of hours, but there's also anesthetic time and recovery time. So the patient will ask, are there any complications to this procedure? And then you will tell the bleeding, pain, and other. What methods will be taken to help prevent blood clots? Patient will be asking you, and you will tell. Can I have a breakfast on the morning of surgery? Will I be put to sleep during the procedure? How long will I need to stay in the hospital after surgery? When will I need a hospital follow-up? When can I return to work? Will I be able to go for swimming after my procedure? How soon will I be able to work after my surgery? Will I be able to go for swimming after my operation? When can I start driving again? How soon can I travel after my operation? And then thank you, and then summarizing.
Oh, too much information.
Yes.
I have a question in my note that
Do you
just
have the
only they ask. You should ask because the patient is pre-op assessment. You should you work as an anesthesia doctor.
yes,
You ask her only about heart problem, diabetes, and asthma,
yes,
and past surgical history and anesthesia history. If
yes,
he have any complication, then could the question is, could the patient go for surgery today? Why?
yes,
And what's the pre-operative workup for this statement? This is
yes,
what I written in the note.
yes.
But actually, I hear this question. You ask this question when I can swim. How can I walk without? Can I walk without assistant or not? How many
Okay.
hours in the operation? Also, they asked this question. I hear from one of my friends.
Yes. So these are the questions that I was given.
What the good answer for this question regarding how many hours the surgery will take? Couples of hours.
It says yes, couple of hours,
And
because there'll be anesthetic time and the recovery time from the anesthesia as well.
what's the type of anesthesia?
General.
She will sleep or
Yes,
general or
she will
spinal?
sleep.
Why not spinal? Because the patient is rheumatic hypertensive.
And
Or we
okay,
can
what you'll say, what they have suggested, that anesthetic will come and see you
assist.
before,
Yeah.
yes, before your operation, and they'll discuss the type of anesthesia that will be safer for you.
Okay.
And
Also, the
maybe
walking.
general anesthesia or the spinal, because you are not deciding, you are asking, you are informing that
Yeah.
anesthetic will come and decide.
Yeah. And also, walking aid, the orthopedic will decide how you will walk, and he will teach you how you walk, and he will give you the instruction for your new hip replacement, because
Yes,
there is some instruction for total hip replacement,
yes,
some special settings,
yes,
some special walking. And
yes,
regarding sport, I think according to the surgeon, he should assist after 3 months or 6 months. She can resume her
yes.
sport activity.
First, it's yes.
The better answer, I think, like this, because
Yes.
some surgeon said after 1 year, after 6 months, according to the surgeon.
Physiotherapist will try his or her best to bring you back to your feet as early as possible. Hopefully already on the first
What
day.
also, according blood clotting, you will, as a warfarin, the patient on warfarin, you will resume your warfarin after the surgery, and if we ensure that there is no more bleeding,
Yes,
and we will give you injectable blood
yes,
thinner,
yes,
and when we will do blood test to evaluate the blood thinner effect.
Yes,
then you will resume your warfarin as before.
yes,
And we also put some pneumatic device on your leg to prevent the clotting during the hospitalization.
yes.
What else? You asked what more?
About the swimming after
Swimming,
yes,
the therapist, physiotherapist, and the orthopedic surgeon will decide
yes,
when you will return to your sport.
yes, yes. Yeah, that's it. Good. Thank you.